I'm Dr. Jerome Pagani.
And I'm Dr. Craig Joseph, and this is DocTalk. Healthcare systems are very familiar with the pressure of delivering high-quality clinical outcomes under enormous cost pressure. But the post-pandemic normal means that health systems are being squeezed by a variety of factors that, while familiar, are new in both scope and overlap. These include low hospital performance metrics, pressure on EBIDTA compared to pre-pandemic levels, higher healthcare delivery expenses due not only to inflation but also the corresponding rise of debt, and labor and staffing shortages. Healthcare organizations need to look for integrated and comprehensive solutions that provide efficiencies across many of these pain points at once.
The U.S. population is both aging and getting sicker. Over half of American adults have been diagnosed with at least one chronic condition, while more than a quarter have two or more. On top of that, a recent study in Nature Medicine pointed to an increased risk of cardiovascular disease in those who had recovered from even mild cases of COVID-19. This is at a time when, according to the American Hospital Association, more than 33% of hospitals are operating on negative margin, meaning even small increases in costs can have dramatic effects on operational budgets. On the labor front, a recent report cited some alarming statistics. During the pandemic, 1 in 5 healthcare workers quit their job, while a survey of nurses found more than 1/3 say they will leave their current employer by the end of 2022.
Staff burnout from increased patient load and reduced personnel means higher risk of medical errors. Further, some hospitals report having significantly fewer beds available and reduced capacity across departments due to staffing shortages. What can be done? Plenty. There are several examples of artificial intelligence being used to alleviate staff burnout, shortages, and contract costs by assisting with scheduling, retention, and recruitment. AI has the added benefit of being relatively easy to implement, and it doesn't bear the burden of reimbursement questions or clinician-patient trust issues. There's also evidence that efforts to improve patient engagement with technology or people solutions can also alleviate costs while increasing quality care at the same time.
Healthcare providers continue to face a range of financial and operational challenges. Increased expenses and low margins are not sustainable for any industry, especially healthcare, and solutions to mitigate the issue range from band-aids to a complete workup. A successful approach includes the interplay of capabilities woven into a cohesive solution framework that addresses many of the exacerbating factors at once. This means a combination of people and services in digital health, clinical and operational improvement, and making the most of efficient managed services. An integrated approach to freeze the squeeze will help to mitigate safety issues, increase patient access to quality care, allow salaried staff to focus on mission-critical work, and wrangle those costs back into the fold.
I was thinking that you just lost something around.
Is that a tailor?
Well, he usually works in wood.